USMLE-style question on Gerstmann syndrome. A 62-year-old right-handed woman presents to the neurologist with complaints of difficulty writing and performing simple calculations. She also reports that she has been struggling to distinguish her left from her right hand and is unable to recognize her own fingers when asked to point to them. Neurologic examination shows no muscle weakness or sensory loss. MRI of the brain reveals an ischemic stroke localized to the dominant parietal lobe. Which of the following syndromes is most consistent with this patient's symptoms? A. Balance syndrome. B. Gerstmann syndrome. C. Anton syndrome. D. Kluver-Bucy syndrome. E. Brown-Séquard syndrome. B. Gerstmann syndrome. Explanation: this patient has Gerstmann syndrome, which results from a lesion in the dominant parietal lobe, angular gyrus, and is characterized by the following tetrad. 1. Agraphia, inability to write. 2. Acalculia, inability to perform simple mathematical calculations. 3. Finger agnosia, inability to recognize or identify fingers on one's own or others' hands. 4. Left-right disorientation, confusion in distinguishing left from right. Common causes: ischemic stroke, most common, particularly involving the MCA territory. Neurodegenerative diseases, parietal lobe tumors or trauma. Diagnosis: clinical plus MRI showing dominant parietal lobe involvement. Incorrect options: A. Balance syndrome, caused by bilateral parietal occipital lesions, characterized by simultan agnosia, inability to perceive multiple objects, optic ataxia, impaired hand-eye coordination, and oculomotor apraxia, difficulty directing gaze. C. Anton syndrome, caused by bilateral occipital lesions, presents with cortical blindness and denial of blindness, anosognosia. D. Kluver-Bucy syndrome, caused by bilateral amygdala damage, e.g. HSV encephalitis. Symptoms include hyperphagia, hypersexuality, and docility. E. Brown-Séquard syndrome, caused by hemisection of the spinal cord, leading to ipsilateral motor and proprioceptive loss, plus contralateral pain and temperature loss. This question tests knowledge of Gerstmann syndrome, its localization to the dominant parietal cortex, and its classic tetrad of deficits.